Yeah, so my name's Katrina. I go by Kat. I'm receiving cancer treatment at the Mater for stage 3 hormone-positive breast cancer of the left breast. So I detected it at the end of April. It was when I was in the shower, so I sort of noticed it by chance. It was a big shock. It's quite, especially the first couple of weeks are quite tough because you get lots of appointments just appear out of the blue when you've went from being relatively fit and healthy.
I meet about 450 women every year who are diagnosed with breast cancer here at the Mater Private Hospital. I met Katrina when she was initially diagnosed. I'm here when the patients need me at any point during their treatment. I'm just a text or a phone call away. I liaise with all of their specialists and help coordinate the pathway so it's nice and smooth.
My role is in giving medical treatments for breast cancer. So that can be anything from chemotherapy to targeted treatments, immunotherapy, and also endocrine or hormone blocking treatments for breast cancer as well. So Kat is having chemotherapy before her surgery. So she unfortunately was diagnosed with breast cancer very, very early. So she's only 30 years old. And so care of her brings into a lot of different things. So we have to think about fertility preservation.
It's a total of 16 cycles of chemo. I've got 5 more cycles of that to go after today.
One of the most confronting aspects of someone being diagnosed with breast cancer is the chemotherapy that we use causes alopecia. It causes people to lose their hair. Here at Mater, in the private setting, we offer cold cap therapy, which helps to maintain patients' hair throughout their treatment and also helps to protect the hair follicles. So after their treatment, the hair grows back quicker and thicker. So it's not just about the medical treatment that they're getting or their surgery. It's about looking after the whole patient on their journey through cancer treatment to try and make it as supported and as easy as we possibly can.
Holistic care is really important. We have our medical oncologists, our radiation oncologists who are our cancer experts. We have our surgeons who provide the best surgical care. We have teams of allied health from physio, dietetics to occupational therapy. We support wellness throughout the entire cancer care continuum.
There's a lot of different side effects that can occur from breast cancer treatment. So this can be reduced mobility, deconditioning, scarring and stiffness. And here at the Mater, we come up with a tailored treatment plan to address these issues. Katrina is currently in the pre-surgery stage and she's undergoing chemotherapy. Improving her physical fitness while she's undergoing chemotherapy will not only help with side effects such as fatigue and nausea, but it's also going to put her in a really good physical place in preparation for her surgery.
Katrina presented with stage 3 breast cancer, but the completion of her chemotherapy, she will have her breast cancer surgery, likely some radiation, and eventually she'll have her reconstructive surgery. So you can see that with every patient that has a breast cancer journey, there is various pathways. Every treatment is tailored to the specific patient. So 1 in 4 women in Queensland diagnosed with breast cancer will be treated at a Mater facility. So the Mater name is synonymous with breast cancer treatment.
We look at the patient as a person rather than just their diagnosis. And I feel like that's really unique to Mater.
So staff at Mater have been really supportive, really kind and friendly as well and approachable. I don't think there's any point where I feel like my opinion wouldn't have been taken into account or anything, or if I've not understood something, it's been explained to me quite clearly. So yeah, I think it has been quite personalised towards like how I would want my care to be.
I think the reputation as a centre of excellence for breast cancer treatment says it all. If you have an organisation that focuses on personalised, patient-centred care led by a team of experts that are passionate about what they do, you're going to have the best outcome for your patients. And we have that at Mater.